Hi, this is Dr. Jean-Pierre Kabungo. I am a family physician, founder of a movement called Home's Dedication. In tonight's video, I'm going to talk to you about what we term pre-primary health care, which is a layer of care before or below the primary health care, because the primary health care is actually defined as the time when you get to be in touch with your primary health care provider. So tell me, do you think your health starts exactly at the time when you get to see your family doctor for the first time? I don't think so. Our health, of course, starts way back before, because by the time you have a small pain here and there, or you can't sleep well, you start to ask yourself, what is going on in my body? And nowadays, many people refer to the internet. They would have searched it. If they have a friend who's doing medicine, they would have called him. They probably go to see the pastor at the church. He would have prayed for them. They've talked to their neighbors. They've tried to automedicate. If things don't work, this is when they come to see the doctor. Can you see the journey that you've taken before seeing a primary health provider? It's very long. So we would like you to bridge that gap, to empower you so you can be really strong enough to be able to take care of yourself between the time you start feeling not okay until you see your first provider. This is what we call pre-primary health care, whose aim is to empower you, give you the tools that you can use in order to stay healthy. I'm a family physician myself. With 20 plus years in this practice, I can see especially how people rely so much on medication. They rely so much on doctors. They've almost surrendered their own health in the hands of few privilege, if that is a privilege. This is what is causing trouble nowadays. Family physicians have burned out. We would like to see medicine differently, because we believe that medicine should not be only practiced in hospitals or clinics. The best medicine, by the way, is the one that starts at home. We would like you to be empowered to take care of your own health, because it's the most important asset that God has given you. We just cannot afford to leave it in the hands of few privileged, if they are privileged, because nowadays they are burnt out because we've given them too much. We've put too much in their hands. They are the ones to decide for our health. We would like to help them have the hand free. At the same time, we are helping ourselves, taking care of our health in our hands, in what we call Home's Dedication. So we would like to empower you to take care of your own health. By this way, we'd like to introduce a new concept of care called pre-primary health care. Please join us in this movement that is going to benefit everybody, starting from you. You live happily and not needing to go unnecessarily see the doctors and unnecessarily taking medications, which sometimes give a lot of side effects. It will benefit the providers, many of which are burnt out. They will have a way to enjoy their life as well. It will help our hospitals. Nowadays, there's no place to admit people. So when you get sick, you don't just think of going to the family doctor. There are a few things that you can do at home by yourself. It will benefit the decision makers, the government. They will spend less. So this is the movement that is not only grassroots as we define it. It is a movement that will benefit everybody. Hence, we would avoid the crisis we are having today in our modern society where we live. Look, we are in Canada. Our Canadian health system has been built around the primary health care physicians. A whopping 20% of Canadians don't have a family doctor. And if it happens for you to have one, you have to wait 1 to 2 weeks to have a booking with those doctors. Imagine you go and see them, they need to refer you to a specialist. You have to wait again 1 to 2 years. If it happens that you go to the emergency department, if really it is an emergency, say for heart attack, you have to wait for 10 hours, up to 16, sometimes more. And then if they admit you from an emergency department to stay in the hospital, there's no place. Hospitals are actually overwhelmed we have now what we call hallway medicine. So this is where people are being admitted in the hallway. They admit you in the place where there is no washroom, no privacy, no place where you can put your belongings. Can you imagine how degrading this can be? That's why I would like to bridge that gap, to just allow people that really need the primary provider to meet them. That's why we would like to give you these tools so you can make your home your first clinic, make your kitchen to be your first pharmacy, and make of your food your first medicine. Thank you for joining me. God bless you.